Good afternoon, doctor. My name is Miguel, and I explain the different options and your question. The hole between the two upper chambers of the heart, left and right atrium, is called a petting foramen oval PFO. This hole allows oxygen-rich blood to pass from the right atrium to the left atrium and then into the left ventricle and out through the aorta. As a result, the oxygen-rich blood reaches the brain. The placenta receives oxygen-depleted blood from the fetus through blood vessels that exit the fetus through the umbilical cord, umbilical arteries. There are two when blood passes through the placenta. It picks up oxygen, the oxygen-rich blood, then returns to the fetus through the third umbilical cord vessel, umbilical vein, hypoxene. Blood that enters the fetus passes through its liver and enters the right side of the heart. Blood returning from the body of the fetus also enters the right atrium. But the fetus can send this low oxygen blood from the right atrium to the right ventricle, the chamber that normally pumps blood and lungs most of the blood, leaving late. The right ventricle is diverted from the lungs through the off-second two additional fetal connections. Now, as the ductus arterius sends oxygen depleted blood to the organs of the lower half of the fetal body. This also allows low oxygen blood to the exit fetus through the umbilical arteries and back into the placenta to pick up oxygen. Since patent foramen oval and ductus arterius are normal findings in fetus, it is impossible to predict whether this connection will close, normally after birth in a normal fetal heart. These two bypass pathways of the fetal circulation allow most fetuses to survive pregnancy, even when complex heart problems are present and do not manifest until after birth when these pathways begin to close. The heart and circulatory system of the fetus begin to form immediately after conception. At the end of the fifth week, the fetus heart is about to pump blood to the body. However, since the how long will not perform their functions until after delivery, when the baby breathes for the first time, the mother must supply oxygen-rich blood to the fetus. Like the heart of the unadulterated fetal heart comprised four chambers and four valves. However, because the fetus lung will not be used until after delivery, the blood must be delivered. From the lungs, the fetal heart develops two structures that allow blood to follow around the lungs, the foramen oval and the ductus arterius. The foramen oval is a hole between the left atrium and the right atrium. The ductus arterius is a blood vessel that connects the aorta with the pulmonary artery. In the normal blood supply during pregnancy, oxygen-rich blood is distributed from the mother's body through the placenta and the umbilical cord to the fetal inferior vena cava. The vena cava also receives oxygen-deficient blood from the body of the fetus. Both oxygen-rich blood and oxygen-deficient blood travel to the right atrium through the vena cava. Most of the mixed blood in the right atrium is pumped to left atrium route. The foramen oval from there it passes to left ventricle, which pumps blood to the aorta. The aorta then distributes blood to the body of the fetus. The remaining blood in the right atrium enters the right ventricle, which pumps into the pulmonary artery towards the lungs. But since the lungs are not working, blood is led from the pulmonary artery to the aorta. Through the ductus arterius, again, the aorta distributes blood to the body of the fetus. After delivery, the foramen oval and the ductus arterius close when the baby begins to breathe. The oxygen deficient blood on the right side. The heart is now pumped to the lungs through the pulmonary artery. Oxygen-rich blood travels to the left, right, and the heart and exports to the rest of the newborn's body and through the aorta, the blood of the inferior vena cava that carries O2 at high concentration, saturation 75%. The placenta preferential and goes to the left atrium through the foramen oval. This ensures adequate oxygenation of the brain and fetal myocardium. We will now understand why the prenatal closure of the foramen oval is a cause of the fetal death. Blood from the superior vena cava reaching the right atrium is directed to the right ventricle pulmonary, artery ductus, arteries descending, aorta in 16% of cardiac output. This is due to evaluate lung resistance that does not allow from flows to the lungs. The patency of the ductus arteries in fetus depend on the hypoxemic state of the fetal circulation and the presence of prostaglandinas A1 and A2 produced by the placenta, the lung, and the arterial wall of the dog. Both relax and expand your muscle fibers. 3. The umbilical placenta and circuit the placenta handles 15% of cardiac output and the vital function it performs are A. Exchange of O2 and CO2 with maternal blood, entry of anabolics, glucose, fatty acid, water, output the catabolitus, urea, lactic acid, endocrine functions, prostaglandinas, production, the cause of heart failure in the first hours, there may be the volume overload produced by the fetoplacenta transfusion in the newborn is placed a position below the placenta. Thanks, Doc.